I'm very pleased to have the opportunity to address you at the outset of this discussion in support of every woman, every child. And I'm really sorry I could not do so in person. First of all, I'd like to congratulate Bayer and the White Ribbon Alliance on their commitment towards realizing the global strategy for women's, children's and adolescents' health. It's inspiring to see an example of a major corporation aligning with an NGO that works at grassroots level. Their joint investments in the field of self-care are ultimately rooted in the issue of empowerment. And we all know that empowerment of women, children and adolescents is central to achieving sustainable health outcomes and the overall 2030 Agenda for Sustainable Development. And I think we all strongly believe that a human rights-based approach to health means empowering people as agents for change. The global strategy on women's, children's and adolescents' health was launched by the United Nations Secretary-General Ban Ki-moon in September 2015. It outlines 9 interconnected action areas that are considered essential to achieving success. One of these areas relates to the potential of the individual. It states that women, children and adolescents are potentially the most powerful agents for improving their own health and for achieving prosperous and sustainable societies. It goes on to say that having the right resources and opportunities can help people make informed choices about their health. One of the other action areas extends this approach to communities. It notes that ideally the whole community, including adolescents, should be engaged in the process of deciding on health priorities and shaping health services for people of all ages. I believe that this is the essence of the self-care approach. A significant part of our health outcomes can be out of our hands, depending on our circumstances. However, in everyday life, it's us who still make many of the pivotal decisions about our own health. If we have a headache, we decide whether to rest or perhaps take a pill. If our stomach is aching, we think about whether to avoid certain foods which could have made us feel ill or whether to seek medical attention. To be able to exercise the power of making decisions around our lives and health, we need to be well informed and empowered to do so. The more we know, the better the decisions we're likely to make. And given that universal health coverage is one of our collective goals for the next 15 years, we all need to think very carefully about how to achieve this target with an eye to ensuring the sustainability of health outcomes. And that's why investments in self-care can enable everyone to achieve greater health and reduce the burden on the healthcare system. Today, there are many creative ways in which we can invest in self-care. Communication has become easier and cheaper than it's ever been. Digital technology and the internet allow previously underserved populations to have access to targeted information that help empower them to make decisions. I thank both Bayer and the White Ribbon Alliance for bringing the important topic of self-care to our attention today. And I encourage all of us working on global health to explore how to maximize opportunities in this area. So with that, I wish you a fruitful discussion, and I thank you for the opportunity to speak with you today.